today, Dr. Tran is going to be talking about Epilepsy 101. And when you hear her present and you hear her warmth and passion, you will all know why we miss her so much. And please enjoy your time with Dr. Tran. Also, if you would like to pose questions, please pose them in the chat. And if you miss Dr. Tran too, go ahead and write that. So, without further ado, Dr. Tran, please take it away and share your incredible knowledge, experience, and passion with the attendees of Epilepsy Awareness Expo. And I just want to give a shout out to thank Brad and Candy and the Expo for pulling this together and inviting such experts like Dr. Tran. We are so very fortunate that they do this for all of us.
Hi, thank you so much, Jana, for that warm introduction. As Jana said, I was in California for many years, I think almost 10 years, and just recently moved to the East Coast and now at Nemours Children's Health. And I really enjoy working with Brad and his and Jana and everyone in this event, because it goes to show how much support and how much and increases the awareness for epilepsy. Because the first thing I always ask and tell our families is, you're not alone. Already, even though you're sitting in our office and the doctor has diagnosed your child with epilepsy, first thing you need to tell yourself is, I'm not alone. We're not alone. Just look at this event. There's so much going on. There's so many people attending. You're not alone. 1 in 26 people will be affected with epilepsy at some point in their lifetime. That's a lot. 1 in 26 is almost, thinking about it, in a school, 1 child in each classroom will have epilepsy at some point in their life. So it's not rare, it's not uncommon, and you have a lot of support. So events like this is very helpful. And I think events like this is where parents and families come to learn to be more knowledgeable and how to advocate for your child, right? I always believe that the best advocate for the child is the parents and the caregivers. No one will advocate for your child more than a caregiver and a parent. And so knowledge is power. And I feel my job here is to help guide you in terms of what questions you should ask and what you should know about your child's epilepsy, so you can be, so you have that information and that knowledge to be able to advocate most appropriately for your child. Okay. So basics of epilepsy. So when your child gets diagnosed with epilepsy, you should ask, what type of seizures does my child have? There's 2 types of seizures. There's focal seizures and generalized seizures. So ask your doctor, what kind of seizure does my child have? Do my child have focal seizures, or do they have generalized seizures? And that's important already. So then that's one information you can jot down in your notebook. I often ask parents to keep a epilepsy journal, because then you can jot down information. Because honestly, when you go to a doctor's office, I'll ask a lot of questions like, what did this look like? What did the child do? What did your child say? And a lot of questions. And so it's really nice to keep a diary, so you can have the information at your fingertips to tell the doctor and refer to when we ask the many questions that we do in a clinic visit. And so determine and based on the history, based on what you see, based on what you observe your child doing, down to the details, it can help us decide whether your child has focal seizures or generalized seizures, okay? So that really goes back into what you see the child doing, what you see your child doing during the seizure. What does it look like? But you know what? The best thing you can do, honestly, is also recording, right? If you see your child have seizures and your child's having multiple seizures before you're able to see a doctor, get in to see a neurologist, just record the seizure. Because when you come to the visit and you just show us the video of what you see, my eyes as an epileptologist will catch certain things, and that really, really is helpful. And so with the technology now on the iPhone video, if you have the latest iPhone, it's like nice video too, right? So just capture a video on it. So and show that video during the visit, because that can be very helpful to the doctor as well. Even if it's you're going to see another doctor for like a second opinion or a third opinion, a lot of times showing us a video of the seizures are very helpful. Okay, so first question, information you should jot down in terms of your child is, what kind of seizures does my child have, focal or generalized? And then the next thing is like what workup, right? So typically the doctor will order an EEG. What is an EEG? And I believe there's other talks around here in this event that talks about what an EEG is and why it's done and how it's performed and whatnot. But an EEG is actually very helpful. It tells me two things. Number one, what's your child's background activity, like in between events or on a minute by minute basis? How's your child processing? What's your child's brain processing at? Is it processing at a normal speed, or is it processing at a slower speed? So the background's helpful in terms of how's the child processing. In my experience, oftentimes when a child has developmental delay or severe cognitive delays, that can be seen in slower brain activity. So the background activity kind of helps look at the child's background activity. What's the brain doing minute to minute? Then the other thing that I look for is abnormalities, right? These abnormalities indicate that I'm concerned this child will have a seizure. And how I typically explain the abnormalities on the EEG is like smoke and fire. When you're walking through and a lot of people have used this analogy too. So when you're walking through a forest and you see smoke, we're all concerned that smoke's going to turn into a fire, right? And so when you see the smoke, what do? You try to put water on it, you put dirt on it, you try to put that smoke out or dampen it as much as possible to prevent that smoke from becoming a fire. Same concept. When I'm reading through an EEG, or when a doctor or neurologist gets an EEG report back, they look for any hints or signs or evidence that there is smokes in the on the EEG. If there is, they'll talk to you about what to do to prevent that smoke from becoming fire. Okay, and the fire is a seizure, and the smokes are these abnormalities. So what will the doctor talk about in terms of, and I'll go through like what are the options to stop the smoke there. But that's what the EEG really looks at. Number one, what's your child's brain doing minute to minute? How's it processing things minute to minute? And number two, are there any potential smokes that we make us concerned that will become a fire or a seizure? And if so, what can we do to prevent that smoke from becoming a fire? Okay. So that's what you ask. Are there abnormalities? And if that's so, where is it? Because sometimes it can be in certain parts of the brain, and that can help in terms of what to do the next step is. So just ask where the abnormalities are in the brain. And that can be very helpful in terms of later on in tracking how your child's going to do. And the other study that your doctor that will probably most likely order is called an MRI. And there's I believe there's talks to talk about MRI, but briefly, it's just a high-def picture of the brain, because we want to take a picture to understand why the child having seizures. And so the MRI is a high-def picture of the brain to give us details to help us understand why your child's having seizures. And so the two common tests that you should ask if my child needs once you get talk to your doctor about seizures and epilepsy. Now, let's backtrack a little bit. What are seizures and what is epilepsy? Epilepsy is a disease, okay? Epilepsy is a disease that indicates a patient is at risk for having recurrent seizures. Seizures is a symptom of that disease called epilepsy, alrighty? So seizure disorder, you probably heard some people talk about, is the same thing as epilepsy. We use those two terms interchangeably. Seizures disorder, epilepsy, it means the same thing. There's no difference. Those two words or those two comments essentially means this child is at risk for having recurrent seizures, okay? And it's the disease process, and seizures are the symptom of that disease called epilepsy. And our goal is to work together to minimize or stop this symptom called seizures as much as possible, so your child can live a fruitful life and live life to its fullest, okay? In terms of other things, what else can be helpful is to talk about treatment. What's the most appropriate treatment for my child? And your doctor will go through a lot of things that can help with treatment. So as it stands right now, there are 4 main ways to treat epilepsy. 4 main ways to prevent seizures to treat, which is the symptom there. The most common one is medications, anti-seizure medications. As the name says, anti-seizure, to stop seizure medications. Also, previously, some people also call it anti-epileptic drugs too. So AEDs, ASM, those are 2 words that mean exactly the same thing. Means the drugs that you take every day to prevent seizures. The second way to treat seizures is epilepsy surgery. So if we're able to isolate and know that the seizures are coming from one area of the brain, that means that that part of the brain is not working well. All it's doing is generating seizures. So that area of the brain may potentially be through a whole host of different testing, we can see if we can remove that area so that we remove the cause, the area that's the bad player that causes the seizure. So epilepsy surgery is the second option to treat seizures. Now, the third option is dietary. So things like the ketogenic diet. I'm sure there's talks here about the keto diet. The dietary therapy is a special type of diet that can also prevent seizures from occurring. And the diet is not indicated or appropriate for everyone, but it's something that you can ask your doctor, like, is my child a candidate for it? And your doctor will go through reasons why or why not the ketogenic diet is an option for your child. And the fourth category of treatment is neural stimulation. It includes a device that's implanted in your child's chest or in the skull of your child's brain to use electricity, sending electrical currents to the brain to prevent seizures or stop seizures. It doesn't cause pain. A lot of parents look, when I talk about sending electrical currents to the brain from these stimulators, they say, is it going to hurt my child? Like, no. These electrical currents are so, in terms of its stimulation and output current, is low enough that it should not cause any pain, and your child should actually even feel the stimulation at all. There can be some side effects because they're activating a nerve. And so you can talk to your doctor about that, and those side effects like coughing or hoarse voice from the VNS can be addressed with some adjustments of the stimulator. Okay, so in terms of, you get a diagnosis, first thing you talk about and tell yourself, I'm not alone. The next thing you ask is, does my child have focal seizures or generalized seizures? And then you go on to talk about with your doctor, which one of those 4 modalities is the most appropriate treatment option for my child. Okay, if they most of the time, it's of the 4 modalities, it's easiest to start the medication. So if it's a new diagnosis, you'll probably get started on a medication. And the choice will be a discussion between you and your doctor based on the results of the EEG and possibly the MRI as well, to stop the seizures or prevent seizures from occurring again. And so you've talked to your doctor about the various treatment options, right? The next thing you should ask your doctor is, and I ask my parents to just remind me too, because I may forget, and it's always nice to remind your doctors, which is, events like this is very helpful. So you are armed with knowledge to help advocate for your child. Emergencies. Well, when is an emergency? When should I be concerned about my child's seizures? Okay. It's called a seizure action plan. It's a plan in place, a plan that you talk to your doctor about in terms of what to do when your child has a seizure emergency. So what typically encompasses, or what constitutes a seizure emergency is when a seizure is lasting 5 minutes or longer, or when your child's having too many seizures in a short amount of time. Alrighty. That constitutes a seizure emergency, because if we don't act appropriately, it may lead to longer seizures for a longer period of times, and it'll be harder to stop the seizures. And so we want to act and intervene early enough to prevent the seizures from lasting too long or occurring and being harder to control. In terms for duration, most seizures last a couple minutes. Every now and then the seizures can last a long time, last longer. And there's a threshold where we get concerned, like this is too long and we need to give the child something to stop the seizures to prevent it from lasting too long. And most of us use the 5-minute rule, where if the seizures last in 5 minutes or longer, you start to give an emergency medication to stop the seizures and hopefully prevent them from lasting too long. So talk to your doctor about a seizure emergency plan or a seizure action plan for your child. And then lastly, another thing you should ask your doctor about is, and I'll just touch on this before I open up to questions, is the cause. Well, a lot of times people ask, why did my child have a seizure? What's the cause of it? And typically I talk about 5 main causes for seizures, 5 main causes for epilepsy, okay? So the one is structural, meaning the brain, the bending and folding and how the brain developed was not normal. And because of the abnormality, brain development and the bending and folding, the child that places the child at risk for having seizures. And the MRI can help in terms of evaluating that further. A second common is genetic. A common cause is genetic. If your child has a mutation that puts them at risk, a genetic disorder or a mutation that's consistent with a genetic disorder that puts them at risk for having recurrent seizures, such as Dravet syndrome, CDKL5, and whatnot. So that's a potential cause. The third is metabolic, and it can be confusing to explain metabolic causes, but how I typically explain it is your body's ability to make energy is abnormal. So when your body needs energy, if you have a metabolic disorder, you're not able to make enough energy, and therefore the brain's not happy. And when the brain's not happy, it causes seizures, right? So metabolic disorders means the body is not able to make enough energy to support its need, and therefore it can cause seizures. The fourth cause is autoimmune, meaning the body, as is attacking a viral illness or whatnot, it also overactivates and has starts to attack the brain's own tissue, and therefore it can cause seizures, called autoimmune. More in the adult world than in kids, not so much in kids, but that's something that you can discuss with your doctor as a potential. And the last is idiopathic. I usually say idiopathic means we're not sure. Everything's normal. The kid's normal development, born otherwise your child's normal, and all of a sudden the child's diagnosed with epilepsy. That's actually the best category to be in, because in terms of good outcome, it's a really good option. It's a really good category to be in. So typically those are 5 main causes of having epilepsy. And so talk to your doctor, ask them after you get the main information, what caused it, and you can go through in terms of what's the next step to do to understand why your child's having epilepsy. And then that's typically that's a lot to take in, and so I typically, for parents, I counsel them and encourage them always ask those questions so you have a good understanding of what your child's epilepsy about your child's epilepsy, so you can advocate best for your child. Okay, so I typically keep this talk to about 15-20 minutes, and then I'll open it up for questions, and we can go on from there depending on what the questions arise. Alrighty. I see there's a question in the chat box from Tara. We are on the 3rd medication for my daughter. It still hasn't stopped the seizures, but our neurologist wants to keep trying this one to try and give it its best chance. When I get, because we have been through this with my oldest, but how long would you recommend staying on a med that isn't stopping the seizures? That varies already. That can be that can vary from child to child already. And so in terms of the length of the medication and how long you should be on it, depends on a lot of factors. Typically, I would not wait. I would give it enough time to take effect. And the time depends on the med, because some meds take longer to see full effects, other meds not as long. And so it kind of depends on multiple factors that I may not be able to address here. But I would say I give it a couple months just to be broad and generic. But it really depends on the medication. If it's some meds like clobazam or Zonogram, which takes at least around a week and a half, 2 weeks to see full effects, and you're on a low dose, every time you increase the dose, you may need to give it another 2 weeks or so to see that effect of that dose change. And so another meds less than that. So it depends on the medication, Tara. So that's something that you can talk to your doctor. If you want to ask, how long does it take to see the effect of this medication? And from there, you can ask, well, if it should see effect from the medication within a month here, and your child's still having seizures, should we start talking about a different way of treating the epilepsy? And that's where an evaluation, a lot of times, I'm going to offshoot on this a little bit. If you're on the second med and still having seizures and already talking about the third med or fourth med, you should ask your doctor, should my child be evaluated for epilepsy surgery already? Epilepsy surgery is not a last resort. It actually should be entertained earlier. And how early? Once the child if the child continues to have seizures despite having tried 2 medications. Because if you fail 2 medications, you have what's called refractory epilepsy. And with that, you should be evaluated to see if there's any type of surgical options for your child. Obviously, focal epilepsy you'll talk more about potential surgery if it's a focal epilepsy. But just because your child has generalized epilepsy, there may be other potential options too, more so probably in the realm of neurostimulation like BNS or DBS stimulation. So just talk to your doctor and ask if epilepsy surgery or there are options in surgery within the surgical epilepsy realm that can help decrease the seizure burden for my child. I don't know if that answered your question, Tara, but I'm trying to be generic as much as possible here. 2 months, so that is very helpful. Okay, it really depends on the medication, Tara. Okay.
Dr. Tran, would you like me to read the questions to you?
Sure.
Okay, the next question is, I've heard the statement that seizures beget seizures. Is this accurate?
Yeah, a lot of people says cells that seize together, network together and whatnot. And it is true to an extent. Okay, it is true. When you have one area of the brain, just thinking about the network, because a lot of times in us in epilepsy, we're starting to think that seizure is not isolated, it's a network. And when one area of the brain or set of neurons start getting irritable and start tickling each other, if it's not controlled over time, they start tickling other parts of the brain. And if it's not controlled over time, it starts spreading. So they like to start spreading spreading their ability to irritate the brain if it's not kept in check. So that's why it's important to decrease seizure burden and also control seizures as much as possible. So the cells decrease their chance of encouraging other cells to join in their hyperexcitable party there. So we want to dampen that because we don't want that. We want them to be normal, quiet, kind of like doing what they're supposed to do and not go off the other end and start tickling other parts of the brain to start creating bigger networks of seizures.
Okay, the next question is, my daughter was diagnosed with epilepsy as a result of HIE and has a couple episodes a year.
Oh, sorry, that was related to the question the statement that I posed, if that was accurate.
In terms of the statement, seizures beget seizures, is this accurate? Okay.
Yeah, I was just giving you more information on like background, like where her epilepsy diagnosis came from, and see if that makes a difference in how the epilepsy would play out due to her brain injury.
Yeah, I'm trying to see how I can explain to you how that statement can hold true. Just HIE is when they were younger, around the neonate age, there was decreased oxygen, and there's been injury to the brain due to decreased oxygen, right? And so that area of the brain was damaged and started scarring down. And when there's damage to the brain like that, it can cause seizures over time and interfere with and start that seizure network. The other parts of the brain are not as damaged, are continuing to do their own activity, right? And over time, it can be that the seizure network can start to tickle the normal parts of the brain and start causing seizures too. So the seizure network gets more broad, if that makes sense. And so to prevent that seizure network from growing, we want to control seizures as much as possible.
Okay. Let's see. I think this might be all connected. Okay, thank you. That is helpful. She's been almost 2 months, so that is very helpful. She has generalized seizures, so I'm not sure if she's able to have any of those.
Clonazepam and Zonegran, yeah, those are meds I usually do consider when I'm dealing with a child with generalized seizures. Again, it depends on a lot of other things that you should discuss with your primary neurologist already. So there's certain medications that are good for generalized seizures. Keppra, Zonegran, Depakote, Topamax, Clonazepam. Then there are other meds that are good for focal seizures like Vimpat, Trileptal, Tegretol. But the choice of medication actually really is a conversation you should have with your primary neurologist, because they know your child best in terms of the cause and the history and whatnot. So for sure, that's a conversation for your primary neurologist there.
Okay, I have a question for you, Dr. Tran.
Mhm.
Since you left us, now you have to still help our families. So we're helping a mom, and her daughter had Dosa Syndrome, and it has been seizure-free for a while, and now it's come back as focal. Is that common to go from generalized to focal?
I've seen that happen. Dosa syndrome or Dosa syndrome is a particular type of syndrome where the child has head drops and myoclonic seizures. They have frequent head drops. And over time, seizures can change. Over time, I've definitely seen kids go from focal seizures to generalized seizures. And over time, I've also seen other children go from generalized seizures to focal seizures. And so, yeah, that can happen. That's why I always tell families, the brain is amazing. It changes over time. And sometimes I'll need to do EEGs closer together to monitor closely. And sometimes I'll do EEGs further apart because I need time to see how it changes over time. And so, yeah, the long and roundabout answer to your question is yes.
Okay, thank you so much.
Mhm.
Okay, group, don't be shy. Please post your questions. Now's the time. Okay, I think this might be a continuation. She started on Zonegran because of also having migraines. Then we tried Vimpat because that one working for her sister who has focal seizures. Now she's on Trileptal in hopes that it works with her genetic variant as well, but it doesn't seem to be yet. I think it's just hopeful thinking for her doctor, but also because we were seeing him soon. I know that was a good reason that he was waiting to change again as well.
Okay, so have a good work with your doctor and see what's the best way to treat and help your child. Their doctor knows your child the best, and I always tell my families it's a teamwork, right? You are my eyes and ears at home. No one knows your child better than you guys do, and so the history and what you tell me, at least for my patients, how your child's responding to medications helps a lot in terms of how I direct and decide on medication or what the next step should be, and how fast or how soon or how what else we can do to help with the seizure. Because sometimes things like sleep is important. I always ask families, how's the child sleep? How's your child sleeping? Because sleep deprivation is a very potent trigger for seizures. And so if your child's sleeping well, it's actually really good for seizure control. But if your child's not sleeping well, it can potentially affect your seizure control. And rather than me adjusting the seizure medications, I actually start trying to work on the sleep. And I sometimes would refer my patients to my sleep colleagues to work on improving the sleep. And many times, once we improve the sleep, the seizure control actually improves. Just think about it. If a brain has a tendency to have seizures, and that means and the brain has a tendency to have seizures, a tired brain is more apt to have seizures or start having seizures, start seizing, right? So you want a well-rested brain. You don't want a tired brain in a child who has a tendency to have seizures. So sleep is very important. Sometimes I would tell parents, like, sleep is nature's natural seizure med, right? Good sleep, good seizure control. Poor sleep, we may have we're probably going to have difficult seizure control. And so sleep hygiene is also very important. And so when I was at Chalk there, I work really closely with our sleep physicians to help improve their sleep quality.
Okay, if there aren't any other questions, I'll ask some questions of you, Dr. Tran.
Yep.
What are your favorite areas of epilepsy, and what hope do you have for medical breakthroughs and scientific breakthroughs to help improve the treatments that you provide for your patients?
My favorite part about epilepsy is honestly the relationships I have with families. It really reminds me to appreciate the little things in life, really. But I like caring for my families and seeing how I can improve their quality of life. In terms of epilepsy, there's a lot of things I like, the new drugs coming out. I really do enjoy epilepsy surgery and evaluating children and work them up for epilepsy surgery and see the difference in afterwards and how the things get changed so much after surgery. And so in the end, I think what I like is the relationships I have with family as we walk through this epilepsy journey, and how the team and the partnership I have with my families, that we can work together to find the best option and best treatment option for the child. At times, the road can be bumpy with a lot of challenges and a lot of hurdles for sure, but persevering through it. I've had many families find after the storm, everything's more calm, right? And when we sit back, when we're at the calm part and we sit back, it's actually very rewarding. So I find that the most rewarding part for epilepsy in my line of work. And in terms of what excites me for the future is the new therapeutics that are emerging for the treatment of epilepsy. I mean, I want kids to be able to be kids as much as possible, right? And so doing laser surgery, so kids are not in the hospital for so long and are able to, if we identify doing laser surgery, so they can get discharged and go back to the routine is very soon, is really impressive and exciting. New therapy like RNS, trying is like, I call it like the AI, right? The response nerve stimulation for the brain for seizure management or epilepsy treatment, where there's a mini EEG machine implanted in the skull, and it's connected to some electrodes that are placed in the brain, and it's constantly reading the brain's EEG. It's a portable EEG reader, right? It's constantly reading the brain's EEG where they replace the electrodes, and when it detects seizures, it sends us electrical stimulation to stop the seizures. And that's very exciting, and kind of it's fun for me, because it's almost like, oh, this little EEG machine in your child's skull is actually an AI trying to learn the patterns that are typical for your child's seizures and trying to react to it, so the child can still be a child and live a fruitful life. And so that's kind of exciting. And then the line, I think gene therapy is possibility for certain genetic epilepsy disorders like DRAVET. And when that time comes, it actually will be very exciting.
Awesome. That is great. Okay, we have another question, and I'm going to piggyback off after this one, because I think we're getting better at diagnosing ESES. And the question is, are there ways to improve sleep for children with ESES?
Are there ways to improve sleep? I think I need more details about that, Renee. Specifically in terms of being able to fall asleep or being able to stay asleep. Because it depends on what the sleep issue is. And that's why I like a consult with my sleep doctors to really get a detailed sleep history in terms of what exactly is it, what's the problem with the sleep? Is it ability to fall asleep, or is it really once you fall asleep, the child has a hard time staying asleep? And so those are identifying the issue will help guide in terms of what's appropriate therapy. So if it's a problem falling asleep, there's certain medications and supplements that can help with that, bedtime routines and some lifestyle recommendations from my sleep colleagues. They've recommended for that. If it's staying asleep, then it turns into a different conversation in terms of what are the best options for that. A lot of times in kids with poor sleep, like they're restless in sleep and they have ESES, some medication can treat both. For example, Onfi or clobazam is one of the side effects is sleepiness. So hopefully it can help both, like help the kids sleep because it's so sedating, but also help with the EEG pattern for ESES as well. And so if the issue is staying asleep, then you can talk about some medications that can help the child stay asleep. And so things like clobazam can treat both, periactin, sometimes Atarax I've used, guanfacine, clonidine. Some of the medications that can help you stay asleep is also important too, and it can also be helpful. And so if that's the case, then you can talk to your doctor, maybe request a consultation. If you already worked that with your doctor and still not making headway, then maybe ask, can I see a sleep specialist, and specifically a pediatric sleep specialist, because then they know the nuances of a child. Because I remember my kid, they had different sleep patterns depending on what age they were. And so a pediatric sleep doctor is more familiar with that, and they can take a detailed sleep history and help you find ways or options and see how we can go about to get your child better sleep.
Okay, so following that is, what are the first line treatments for ESES?
First line treatments for ESES, it can vary from provider to provider already, so it's there's no set guideline for it, but common meds we often use include Depakote or Onfi or Zonisamide, or Onfi or like Depakote, Onfi, also called clobazam. Those are the two common meds we usually start with already. And after that, it kind of depends on the child and how the child's doing, and a variety of other things. Sometimes we've used a brief course of steroids as well to see if it can break that abnormal ESES pattern if the pattern is not improved on Depakote and Onfi. So first line treatments typically is Depakote and Onfi for most places.
Okay, wonderful. Thank you for that. I put Dr. Tran's contact information. I just put it all in there. I hope it's accurate, Dr. Tran.
We got it off the website.
If you need to see her or want to see her, we want to help facilitate that. And the next question is, I'm not familiar with that area, Dr. Tran.
Yeah.
What geographic areas does your hospital cover, and what areas do you pull from, so the people that are on this Zoom can better understand if they might be able to visit you?
So we Nemours Children's Health in Delaware Valley serves the tri-state area, is what we call it. So I have clinic in Delaware, Wilmington, Delaware, to see patients in Delaware area. I also have clinic in Glen Mills, Pennsylvania, in the southeast part of Pennsylvania. Then I also have clinic in Deptford, New Jersey as well for patients in Jersey. And so we typically serve the southeast portion of Pennsylvania. A lot of patients from South Jersey, sometimes from Central and North Jersey, depending on insurance and whatnot. Mostly South Jersey area, and also obviously all of Delaware and some parts of Maryland too. So in terms of geography, if you look at Wilmington, Delaware, north as far as, I'm still learning geography here, but south, Pennsylvania, parts of Pennsylvania, or parts of Jersey, all of Delaware, and parts of Maryland. Let's put it that way.
Well, that's good to know, because, we get calls from everywhere, and Brad knows all about where you are, and it's all locked in, but now ESNOC needs to be all locked in so that when we get calls, we can direct them your way. So thank you for taking time to explain that. And again, Dr. Tran's information is in the chat. Okay. Let's see, another question. He also has Chiari and obstructive sleep apnea, so it's hard to pin down the cause.
Okay, so I think probably the OSA maybe Potentially, I don't know, he's been seen in by pulmonary and sleep clinic to work with you on a CPAP or something to help him improve the sleep from the OSA, or has he been seen by ENT doctor to evaluate his tonsils and adenoids? Those are, I think, things that you've already addressed with your doctor. So continue working with your team to see if we can improve the sleep there.
Okay, I have another question. While I have you, I'm going to take full advantage. How are you liking the new emergency medications, Valtoco and Nasolam, as it seems like Diastat's being phased out, and you know, it's
easy. I like it. Yeah, I like the nasal spray. I personally really like the nasal spray. I was very excited when it finally got really, because it's quality of life, right? And then also for the child. You don't want to have a rectal medication administered in public or at school, because a child spends most of the time where? At school and at home, right? And friends and people at school are very important, and they want to make sure you want to make sure they go to school and have a good social life. And so I love the nasal sprays. It's a way that is easy, it's fast, and there's no embarrassment, for lack of better words, right? And so I really like it. In terms of which one do I like better, obviously between 6 and 11, it's only Valtoco as the option. In terms of 12 and above, you either can do Valtoco or Nasolam, either of those two. At that age group, which one do I typically choose? It kind of depends on your insurance. Both are just as effective. Typically, I would prescribe whichever one your insurance approves and doesn't insurance approved. And so I like the nasal spray. I think it's really helpful for kids. It helps them be able to live, be a kid, essentially.
I apologize for my background noise, but I wanted to add too that I think we're going to see less anxiety with children and young adults and our teens, and because just knowing that they had rectal medication, I think it adds a lot of stress on them socially and emotionally, medically. And I think we're going to see a nice transition of a loss of that social stigma and the anxiety. So I'm hoping that with lowering their stress, it also, lowers the opportunity for seizures, because from what they tell us, they do stress about that.
I've heard that too.
They do not want it. So
this is, and it's also for parents too, right? Some kids, when they're when they get tall, and teenagers, when they're tall and they're bigger than their parents, it's hard to administer the medication. I can only imagine. Jenna, you know me, I'm a little petite person, so I can imagine administering a Diastat on a bigger kid than me. So a bit, so I think it also helps not just for the kiddos for whatnot, but also for parents to make it easy, because life is hard enough as it is. And I always say kudos to my parents, because having a child with epilepsy is really hard. So kudos to you. And we want to do everything we can to make your life as easy as possible. And so with a nasal spray, as a quick spray, it makes life easy for you. Is nasal still available for younger kids? So the one that's FDA approved, which is Valtoco, is only approved for 6 and above. Alrighty. I know there are hospitals out there that do dispense the IV medication, where the parents draw up the medication from an IV bottle, and then you would swap it out for automatizer and use that to administer. And yeah, if you're able to get if your hospital or your facility or your doctor is able to prescribe that, that's still a viable option. Because other places sometimes, because I get nervous with parents having, in the midst of seeing your kid having a seizure and using a needle to draw things up, use a medication called Clonazepam Odt. There is a dissolvable medication that just you put on the tongue or the cheek or inside the mouth, and it dissolves over time and can act like as a seizure medication too. And you said the hospital pharmacy gives it to us in pre-drawn syringes. Perfect, excellent. So that works well too. Some hospitals can do it, some don't. Some are not able to for a variety of reasons. And so that goes back depending on your facility, if your facility is able to accommodate you for that.
And so you are happy with the way they're working. You're happy with the transition. We're all happy. We're moving forward. We're transitioning out. Okay. I value your opinion, and everyone is happy too. So thank you for that information.
No problem, no problem.
Do we have any other questions? If you could please post them in the chat. We still have about 14 minutes that we can do a Q&A. Is there anything you would like to share with us, Dr. Tran, about maybe up and coming treatments or something that's going to be around the corner that we should be looking forward to or preparing for?
Up and down the corner to be prepare for. There's new in terms of medication wise, I think there'll be some new meds over the next couple of years that can be approved for certain treatments for epilepsy. I think the one that a lot of us are looking forward to is fenfluramine or Fintepla to get the FDA approval for treatment of patients with LGS. Oftentimes our patients with LGS have the refractory seizures and are difficult to control on the current available options. And so Fintepla or fenfluramine being a different medication, works on a different pathway, offers a potential, another option for families with kids having seizures from LGS. And so down a couple years down the line, like I said earlier, gene therapy potentially with Dravet syndrome. I think if you go on the Dravet Syndrome Foundation, there's certain links on there for potential to learn more about where the status is on this option. And so that's actually exciting. I've been trying to follow that closely and see what options are for our families with Dravet syndrome there. And at the top of my mind, that's what pops in my mind that gets me like, oh, let's see if that's, popping up, open my email to see the latest news coming through my inbox and what can I looking forward to, kind of like catches my eye. And those are two things that pop up in my head right now when I'm looking and when I look through the news for the latest epilepsy updates.
Great, wonderful. Thank you for that. We, as you know, we work with that 30 to 40% of the population who is constantly seeking seizure control. So we're always trying to, keep them hopeful, offer them hope. And a lot of times it's a waiting game to continuously try the existing medications or the combinations. But I know it does offer the families great hope. And yes, if Fintepla could be effective with LGS patients, then that is really would be a wonderful option for them. I have a very soft spot and deep concern for the the rare diseases that they used to call catastrophic, because we do need more treatment options for them. And sometimes they are forgotten, but boy, they're being remembered in the last couple of years with Fintepla, and I appreciate that.
For sure.
Okay, we have another question. Have you seen any issues with COVID vaccines and epilepsy or with any seizure meds? My kids are scheduled for this Saturday, and I'm so relieved.
Awesome. I'm so happy you're getting the COVID vaccine. I mean, vaccination is how we can start moving forward and trying to move more towards our new normal here. It's been quite an interesting couple of years here, to say the least here. To my knowledge, there is no contraindications or specific issues with COVID vaccines and epilepsy or any of the seizure medications or interactions or contraindications. Like with any vaccinations, sorry, I just got a page here. Like with any vaccinations, it can cause a fever. And I know if you talk, a lot of adults who've got the COVID vaccine can get fever and febrile. And as you know, kids with epilepsy, when you have a fever, it can lower your seizure threshold. And so that's what I can potentially foresee can happen is if you have epilepsy and you get the COVID vaccine and you have a fever, it can lower your seizure threshold, which may bring out which may provoke a breakthrough seizure. And it's from this fever, not so much the vaccine directly. I imagine it's from the fever, just like with any other vaccine. And so that's treatment with the symptomatic treatment. If it hurts, just give them Tylenol and try to be on the lookout for fever, and knowing if they're starting to creep up, keep them, give Tylenol to see if we can keep the fevers low and prevent high fevers. But I would say I wouldn't be, there's no contraindication, but do support people who are taking their kids to get the vaccine. And for seizures, no contraindication. If anything, I would worry about the fever causing a breakthrough seizure. So antipyretics to help with the pain and fever is something that maybe you can consider for your child. In terms of medications, I don't know of any interactions that, to the best of my knowledge right now.
Okay. Any other questions? Please pop them up. Is there anything else that you would like our viewers to know, Dr. Tran, about pediatric epilepsy and seeking treatment?
I think I often sometimes just want to put my mom hat on, is don't give up already.
Please do. We love that.
Because I can speak from the doctor's side, but I can, as a mom, I know I'm struggling with my teen and preteens at home here, and it's hard. And don't give up already. Always looking to see, always think about and ask, what are my goals? What do I want my child? What do I want best for my child? What are your goals for your child? And in terms of working with your doctor to achieve what you, for goals and treatment goals, it's really important for you to not lose sight of what you want for your child. In terms, do you want quality of life? And in terms of quality of life, what are you okay with? What are you good with for quality of life? And never give up. If you feel like there's, I always ask my family, if you're not happy and there's a little voice inside you saying, I think I need a new set of eyes, trust your mommy gut feeling, right? I mean, no one knows your child better, and you're the best advocate. I can't emphasize that enough. And I just want another set of eyes, just be honest with your provider. Just say, I really like you as a provider, and I really enjoy, I think you're doing everything you can for my child, but we're on the 3rd or 4th or 5th mid. Is it okay that I just have a new set of eyes just to review see the case and just give another input to see what are other options out there, and just have an open conversation. Most of my colleagues who are respectful doctors I work with and I would refer to any day will be more than happy, and we'll be okay with that and will not take that personal at all. And so it's if you feel like you're not making headway, or your child's still not getting better or not meeting what your goals are, go ask for a second opinion. I think in Orange County there, you have many great level 4 centers there. And so a new set of eyes often can unveil something that may have been glanced over earlier, or reviewing the record saying, oh, this worked, maybe we can continue trying this. Because I often tell families this, like, just because you tried a med 6-8 years ago and it didn't work, it doesn't mean it won't work now. Okay, how a child responds to a medication when they're younger versus when they're older is different. If a med worked when they were young and didn't work when they were younger, it doesn't mean we shouldn't consider trying and being open to trying it again when they're older, because the brain will respond to things differently. For young, and I've had many kids where, oh, I was on this med, she was on this med when she was young, it didn't work. I'm like, well, it's been 8-10 years. Let's just give it a try, give it a shot again and see if it works, because all these other medications didn't work, and your child's not a surgical candidate. And unfortunately, the ones that I'm not then we go through the options and I say, let's try this again. Let's be open to trying old meds again, because you never know. I've had it where it actually did work. It actually got the seizures under control, and the kid just continue on with their life. So just keep an open mind. Always don't give up. And it's okay to seek a second opinion, to get a new set of eyes, to take a look again at your child's story.
Thank you, Dr. Tran. I was just trying to get an idea of where everyone was from, because I don't know where everyone's from or where they'll be seeking treatment. But I absolutely, oh, we got Portland, Oregon.
I grew up in Portland, Oregon. Well, not Portland. I grew up in Vancouver, Washington. But I spent most of the time in Portland with my friends.
And then I went to Portland State University. Remember we had that in common?
Yeah, PSU.
Yeah.
PSU, yeah.
Oh, Mustang, Oklahoma. Look at that. This is a great.
Wow, Oklahoma.
LA. So
downtown LA. Oh, we're all over the place here. Got East Coast from me in the East Coast, got Midwest in Oklahoma, and my home stomping grounds, Portland, Oregon.
Yeah.
Go Ducks, right? Go Ducks.
Exactly. And if any of you need help with finding an epilepsy center, we're happy to help you find an epilepsy center in your area. So you can go to our website. And
Dornbeckers, yeah. I spent a summer doing research up there in Dornbeckers Children's Hospital. It's beautiful there.
And where is that?
Dornbeckers Children's Hospital is in Portland, Oregon. They do have a level 4 epilepsy center there. I don't know if the doctor that I met is still there or not, but it's a beautiful hospital. The view, Mount Hood, you can see Mount Hood there. I remember going to that bridge there on my lunch break when I was doing research there that one summer.
That's awesome. That is great. So yes, if you want to get in touch with us, we will help you find an epilepsy center in your area. And there's a National Association of Epilepsy Centers too that you can find on the internet. We all want you to have the best possible care, especially if you've been struggling with epilepsy for quite some time. You know, we're all here to lessen the suffering of one another and help one another with this complex condition. And so I'm glad to see so many people tuning in to this wonderful event and listening to one of our best world-class pediatric epileptologist, Dr. Lily Tran.
Yeah, not world-class. I just like what I do. I really enjoy what I do.
Well, we think of you as that because you did so many wonderful things for the people in Orange County. Well, we are ending our time, and thank you, Dr. Tran. We appreciate you, and we appreciate the Interactive Epilepsy Awareness Expo, and we hope to see you in person next year. Wouldn't that be wonderful?
Yes, I know I have a few nurses here who really likes to go to Disneyland, so
well, let's make that happen.
We'll see about that.
I think Brad can help you out with that, okay?
Yeah, I'll touch base with you, Brad.
Yes. Okay, wonderful. So good to see you, and take care. And wishing you the best and your family too.
Awesome. Thank you. Take care, everybody.
Thank you so much. Bye-bye.
Bye-bye.